Thank you very much, Valentina, Phillipa, Elisa, and Sara, who are with us today. Thank you very much for joining us from all corners of the world. Valentina will introduce you in a second. I just wanted to give a very warm welcome to all of you, all the people who are joining us from all parts of the world. DRC, we just had joining us here. Last year, we did a survey amongst more than 5,500 people in 132 countries, and the survey explored people's experiences with crashes, with road crashes, and this survey data and the testimonies really showed how crashes affect many of us, and not only affects us emotionally and psychologically, but also affects our income and really overall undermine citizens' opportunities in education, in employment, and how crashes contribute to creating inequality in the world. So when we started these sessions here, the live sessions, where this is the fourth of them, we spoke to our members about, this was actually spurred by the COVID-19 pandemic and what we saw in our communities. And we really wanted to link road safety with the SDGs. And as we also showed in our survey last year, there's a lot of links between the SDGs and road safety, and there's a close link between poverty, inequalities, and road safety. And therefore, we invited you here to talk to us today. Valentina will be with us from Handicap International to moderate this session. We have invited Phillipa, Sara, and Elisa to join us. So very much welcome to you, and over to you, Valentina.
Thank you. Thank you, Lotte, for this introduction. Let me share with you a few slides that will frame a bit the content of our chat today. So as you know, we called this online session Inequalities during the COVID-19 outbreak, with the idea of creating connections and also inspiring dialogue with the road safety community, which I think many of those who are now attending online belong to. Let me check how I can, yeah. So the speakers, just very quickly, for those who missed the very initial part of our session, we have here online Elisa Visconti, Head of Programs from ActionAid Italy, based in Milan. Sara Munera Orozco, founder of Educacion para la Inclusión, Colombia, and Phillipa Tucker, Director of Research, Development and Resourcing from Accountability International. And myself, again, Valentina from Humanity and Inclusion, also known as Handicap International. Why I'm here, what I'm doing today. Humanity and Inclusion, HI, is an aid organization. So we work alongside persons with disabilities, but also other vulnerable populations, in particular in situations of poverty and exclusion, conflicts and disasters. We are working in about 60 countries, in low and middle income countries. And since 2018, Handicap International Network became Humanity and Inclusion, so you might hear of us with this new name. Our programs varies from education, livelihood, emergency settings, health, access to health, etc. But also we have some projects around road safety in countries like Haiti, Burkina Faso, Democratic Republic of Congo, and I saw that a colleague of mine from there is now also online. And therefore, we are a member of the Global Alliance of NGOs for Road Safety, and very pleased to be here today to facilitate this session. As Lotte was saying, we asked ourselves, why should we discuss about inequalities in the frame of road safety and in the context now of this global crisis? And we realized that indeed, when we look at the road safety sector, we are already quite familiar with the concept of inequalities. If we look at the road safety field, we already see that more than half of global road traffic deaths are amongst vulnerable road users. We also can see, and there are data about the fact that people in low-income countries run a 3 times higher risk of dying in a road crash. And 88% of pedestrian travel occurs on roads that are still unsafe. So inequalities and specific issues related to vulnerable groups are definitely core matters when we look at the road safety field and the actions that the road safety community is undertaking. And also when we look a bit broadly in the road safety field, we also see that unsafe roads are a major factor for social exclusion and prevent many people to access to basic services, education, work, health services, going to the university, just moving around in freedom and safety. So the social determinants of health, of course, have been at the core of discussions around road safety since they're shaping road safety. And very similarly, these factors are having an impact on the way we are seeing individuals and communities being affected by the COVID pandemic. And when we speak, of course, about social determinants of health, it means the socioeconomic status of a person, the education level, the employment status, but also the neighborhood or the physical environment in which this person lives, personal condition, health conditions, etc. And all these, of course, as a role when we look at the impact of road unsafety, and they have a role also in the way we are responding to the COVID pandemic. So we see this alignment, these parallel situations when it comes to social determinants of health. And the way COVID-19 is spread in the population and determines people's opportunity is very much depending on social and economic factors as well. And we have seen probably this image quite a lot on social media in recent times. We are in the same storm, but we are going through the storm with very different tools and very different opportunities to face it. So we see there some big and well-equipped boats, some other smaller and less equipped boats. So people are definitely differently affected by the current pandemic, with the risk that inequalities will be exacerbated within and across countries. And this is, I think, quite a matter of facts. And this is what we're going to explore further today with our speakers. On the other side, what we've also seen over the past month, is that there is a revamped sense of individual and social responsibility. There have been quite a lot of solidarity initiatives in cities, in neighborhoods, in communities. And we've also seen that civil society is definitely playing a big role, both in advocating for duty bearers to take actions, but also to hold them accountable. So there are definitely things that we can learn from this crisis and opportunities to partner more, to break the silos and go meet other partners outside of our standard field of works. So I will let the speaker go ahead. We have two questions actually for you, and then there will be also the opportunity to answer questions that will come from participants. So I think that my first question that I will ask you to answer is about how have you seen specific groups of people being impacted by the COVID crisis, and if you have seen that there are more inequalities than before. And I will ask maybe to start with Phillipa, if you are online.
Okay, well, thank you everybody, to Lotta, to Liz, to Valentina, and to Sara and Elisa for being here. I'm really happy to be part of this conversation. In my work at Accountability International, I can tell you that because we work with the most vulnerable people globally with a specific focus on Africa, that the people we're seeing specifically struggling with both coronavirus disease and with the lockdown are people who are sex workers. They're not being able to work because of the laws that are put in place. We're thereby seeing that there's a lack of money. We've seen a lot of suicide of sex workers because of this. We have women in homes who their husbands do not know that they're sex workers. So even when the sex worker associations come around and provide them with free food parcels, they have to turn them down because otherwise they will be revealed to be sex workers during the lockdown. And then obviously we all know that there's been a lot of violence within the homes, domestic abuse or sexual and gender-based violence. And these women would then be at a greater risk of physical and sexual abuse. We've seen a lot of lesbian, gay, bisexual, and transgender people, as well as intersex people, who would otherwise couch surf or move around significantly between friends, being forced to go back to a family homestead, where families are homophobic, lesbophobic, transphobic, and that there is an incredible amount of physical, sexual, and mental abuse that's happening. We're also seeing funding for these communities being withdrawn and being moved to COVID-19. We're seeing, obviously, I think is very high on everyone's agenda is the gender-based violence. And I think it's very profound that hashtags have emerged where people are posting photographs of themselves of being hit, and that hotlines are ringing off the hook. We're seeing a lot of, for example, in a country like South Africa, where there's a lockdown against cigarettes and alcohol as well, we've seen alcoholics go into delirium tremens and have uncontrolled removal from alcohol, which can cause death. We've seen drug users not being able to access their drugs or the replacement therapies and die because it's an uncontrolled removal from the substances that they typically use. And we've seen HIV positive people not have access to their medication because of supply chain issues. So that gives you a kind of feel for the very broad group of people who are being affected, the most affected. And these are people who, when they present at clinic, they're not going to be helped really because of the stigma. I'll stop there.
Thank you very much, Phillipa, for this insight. Sara, would you like to complete more with a point of view coming from Colombia and from the disability-based organization?
Yes, thank you. So I would like to start by saying that this crisis has made more visible the inequalities that we knew already existed, both for people that Phillipa just mentioned, but also for people with disabilities. So one important issue is access to information and communication. So on one hand, the information that is shared is not accessible to everyone. Sometimes sign language is lacking from even the information that the president here in Colombia delivers to people. Sometimes information is really difficult to understand. We don't have pictograms or images supporting the information, and easy to read materials are not being developed. And on the other hand, related to information, the guidelines are not specifically developed for people with disabilities. So when you say wash your hands to a wheelchair user, you should remind them to wash also the pushrooms. Otherwise, they will be not cleaning their hands properly. And if you're talking to a blind user who uses their hands to move around in space, they also need to keep hand sanitizers on their bags and do this more often than other people. When you talk to people who use sign language to communicate, we also need to remind them that some signs need to be done differently. So for example, in Colombian sign language, when you say dad, you do it like this, but you're touching your face. So we need to explain them that they need to modify the way they do signs. And in some parts of Colombia and Latin America, we don't even have access to water or soap. So this message should be modified for those people to make sure that they are taking care of themselves as well. Another important issue that we have seen is that those living in institutions have a higher risk of getting COVID-19. And also when people need access to personal assistance, some people with disabilities need support to get dressed and to eat. And due to social distancing, this has been really difficult and challenging. In terms of education, we all know that these online platforms are now being used, that people with disabilities have less access to internet connection. And when they do, it is more difficult for them and their families to use the internet. Some governments in Latin America have been using TV shows as an educational method, but unfortunately not all of those implemented sign language there as well. And there is one last and really important issue, which is access to healthcare. So access to complex rehab technology, such as wheelchairs, has stopped in most countries nowadays because we cannot do all the evaluations needed to deliver these products. But also some governments have been prioritizing who gets access to ventilators. And unfortunately, those with disabilities, as well as the elderly population, are on the bottom of that list. And I do think that we have been more aware of inequalities, particularly for the people with disabilities, thanks to the Convention on the Rights of Persons with Disabilities. I think this has provided a basis for the community to reflect on what's going on and on the decisions that governments are taking and on how this impacts their lives.
Many thanks, Sara. Thank you very much for providing your insight. Elisa, would you like to go ahead next in answering this first question?
Yes, Valentina, thank you very much. It's quite difficult to add to what Phillipa and Sara have been telling us, because basically they said it all. I'm very negatively impressed by the fact that our experiences in very different parts of the world, I'm talking from Milano, and I'm talking on behalf of ActionAid in terms of national program, and therefore like I'm referring to the impact of COVID-19 in Italy. And to hear to what my colleagues are describing is quite impressive, because I could have said exactly the same thing in a very different context, sitting from my home in Milano. So obviously we have a problem, I would say, without adding items to the list, which is already very comprehensive. What comes into my mind is that a crisis can have a double function, you know. It depends on the way you look at it and you try to address it. Obviously, on the one side, what we are all experiencing here is that this particular crisis is exacerbating existing inequalities. We are talking about people who are already vulnerable in a regular situation, you know, at the peacetime, I would say, and due to the crisis are becoming even more vulnerable and even more marginalized and invisible. I would say it's exactly the same in my country. Women who survive domestic violence, any sort of gender-based violence, people living with disabilities, people living under poverty line. I mean, all what has been said before is the same here. So this is one model, and apparently our experiences is telling us that unfortunately this is the model at least the countries we're referring to are actually facing this crisis. I was lucky enough in my professional career to see and discover and learn there is another model, which is the one which we are not applying apparently, that take advantage of a crisis as an opportunity to try to reduce the gap in terms of access to rights of all people. And that is what I would say, into very big brackets, the positive side of a crisis. It's an opportunity to try to look at the situation and the socio-economic, cultural, economic context with different lenses, which are lenses of inclusion and lenses of equal access to rights for all. And if governments, if transnational bodies will look and face crisis with these lenses, then a crisis could become an opportunity for change and an opportunity to reduce a gap, which is chronic, unfortunately, I would say, in terms of equality or disequality. This is not what I'm experiencing in my country, and if I understood well what my colleagues are saying, this is not what in general, unfortunately, we are experiencing. And if I have to look at the future, maybe this is the road we should take in advising our governments or advising decision makers. I use this opportunity to reduce the gap in terms of equality. Otherwise, we're just experiencing this crisis as a huge mirror reflecting what is there and making it worse. And then, yeah, I wouldn't add specific things because recently they cover it all.
Yeah. Thank you, Elisa. And indeed, I think that what you just mentioned connects perfectly with my second question for the three of you, which is really about what we are learning, what we can learn from this crisis, and maybe how also we can turn it into an opportunity in terms of social cohesion, inclusion, access to all rights for everyone. And also, what is the role, because the three of you are actually representing different sectors of civil society and NGOs. So what is the role that civil society, NGOs, local communities can play to be part of the solution? So Elisa, if you don't mind, since you were already connecting to this, I would let the floor to you.
Okay. Well, what we are learning that beside all the negative side that we've been listening, the dramatic side we've been listening before, on the other hand, at least what I'm observing from my desk is an amazing response of solidarity and support at local level, at level of communities, sometimes a regional or national or even international level. It's like the resilience of a community or a country or a set of countries, the resilience of people, bottom up, I would say, is showing in all its strength and power in the past month, and somehow is compensating to the lack of view of strategy of our governments, at least my government. I feel free to talk about the gaps within my government. And this is something that maybe could teach us something and something to capitalize on. What is the role of the third sector or civil society? Well, on the one side, I think this is the time to come out from our own boxes, to create new alliances, to enter fields of expertise which normally we don't look at, because I'm an NGO working on education or on disability or on water and sanitation, but maybe this is the time to think outside our boxes to create a strong network that can actually work at very different level, from the basic level of service delivery, which is essential at the beginning of a crisis, to higher levels, coming all the way up to advocacy and bringing a recommendation to government or the European Union or different international bodies. I'm very happy that Phillipa is here today, because one of the main issues we're facing in a European country, in Italy right now, today, is accountability. Citizens are not treated as citizens in Italy since the beginning of the crisis. We are asked to obey, to follow rules, to trust the government. We are not put in a position to raise questions, to ask for transparency, to ask to be actors. Nobody is sitting in the parliament remembers that they're there because we have been voting them. And they're not, our parents telling us what to do. They're entering every little details of our personal space and life. We don't know if we can have an ice cream with a friend. We can have it with a cousin, but not with a friend. The national regulation enters into the very nitty-gritties of our life, but we don't have a say. We can ask why we don't have an organic a national health system during the crisis, why we don't have one diagnostic system, etc. So what we can learn and what is the role of civil societies right now, for me, it is also to remind ourselves that we are citizens And during a crisis, the active participation of citizens is a right, it's a part of solution. Having an army of citizens just obeying rules doesn't work. We should be part of deciding what to do, analyzing the problem, and designing a future for our respective communities and countries. So yeah, that is my main concern right now.
Thank you very much. I can definitely very much relate to this, myself coming originally from Italy. But I think it's a situation very common also elsewhere. I'm also seeing that some of you are putting questions in the chat box. That's great. We'll take time at the end to try to get an answer from the speakers. Sara, would you like to maybe continue elaborating on what Elisa already started saying, whether if you have additional perspectives that you would like to bring in relation to what we are learning and what can civil society do in this?
Yes, definitely. And I just love what Elisa was mentioning, because we are all citizens, right? And we are equal citizens, even people with disabilities, of course. And as I previously mentioned, people with disabilities and the elderly population are at the bottom of the list for those getting ventilators. So there is an implicit question about who counts fully as a person and as a citizen, and whose life has more value and more meaning than others. So unfortunately, we have learned that as a society, we still value the life of people with disabilities less than the value of other citizens. And I think that is something heartbreaking, and that we need to start doing something about it. On a positive note though, I also have seen that people with disabilities and the disability community are not being only beneficiaries, but as Elisa was mentioning, they are being part of the change and being part of the people that are discussing the current situation. So I think that sharing and compiling good practices can be beneficial for everyone at this time. And people with disabilities and the disability community have been doing so, having webinars with WhatsApp chats and so on. And I also think that we need to start thinking on solutions for this crisis. So non-governmental organizations, community-based organizations, and disability agencies should be definitely working together with the government so their rights are considered as a priority on this crisis.
Thank you, Sara. Phillipa, what would you add to this conversation?
Phillipa, I think you're on mute, sorry.
Sorry. I was saying it's hard to come after those kinds of answers because you covered so much in depth. But my colleague has this expression, which I'm sure is plagiarized, which is never let a good crisis go to waste. And I really think that, you know, this is a crisis. It's something that has changed the face of most people on the planet. There's very few people who are unaffected by this. And I think what I keep hearing is this idea of solidarity. It's something I spoke about a lot in Stockholm as part of the road safety ministerial meeting there. We need to start developing a broader accountability movement. You know, we leave the office and we say, I'm going to a women's rights march, or I'm going to the gay pride, or I'm going to, you know, access to housing march. I look forward to a day when we go to a human rights march, where we all march for human rights. And I don't think that we will negate the technical expertise of people of different areas by working together more and having a broader human rights and accountability movement. Moving to accountability, I think that we need to understand the technical foundations of accountability, what it means. We need to have some accountability literacy under our belts as civil society and as activists. What it is, how do we get it, where do we get it from? We need to understand good governance. We need to understand that they're public servants, that we vote them into power, and that we can vote them out, and we should do, and we should be mobilizing around election time much more than we are. I do not see civil society mobilizing around electoral issues as much as we should be. I spoke as well in Sweden about making road safety an electoral issue, and it really should be. I think the other thing that we could be doing as civil society is changing the collective narrative. Here in Brussels, suddenly it was available to have a hotel to put people who are sleeping rough or homeless. There was a hotel to put them into, because when people who have power and influence are affected, somehow we can find a solution. And I think we need to understand that we need to put this kind of pressure on much more of the time. And I think I come out of the HIV movement. They trained me, my HIV positive friends trained me in terms of how to make change. And I think in terms of how we made change in the HIV world is by getting angry and channeling that anger. And that's what I keep saying to people. Do not worry about being polite to the people who are trampling your human rights. Do not worry about upsetting people. Do not worry about being diplomatic. Fight, because that's what we do. We have to fight for these human rights. That's it.
Thank you very much. Very, very inspiring, all the three contributions. And I think indeed this inspiration also got to some of those who are following us. We have Olive saying or writing in the chat, very interesting to hear Elisa describe the loss of voice by citizens in Europe. In Uganda, the COVID task force is headed by an army general, and between them and the police, they hold the population captive. Very frightening. Civil society might be able to negotiate for space and accountability. I think now it's already time for our Q&A, and I see that there's Donna already who wrote something in the chat, but we also had another person before asking before the webinar for a question. Well, we had many questions that we pulled together into one. So maybe we start with the questions that we received before the webinar, and then we'll go to the questions that are now appearing in the chat. Summarizing what we received before the webinar, I think that the key questions would be how to work together as a civil society. You mentioned, all the three of you, we should break the silos or create a narrative that is a bit more comprehensive than what we have right now. And indeed, when we hear words like public safety, accessibility, affordability of health, education, human development, I think these words are relevant for many of the sectors where we're active, including for the road safety community. So how can we really build together this narrative, break the cycles, and promote a virtuous way of working? And I maybe let you, if you just let me know who's ready to answer to this, and we can then go through the chat later.
I think I would like to kind of summarize what we have been saying. And I think that a great way of working together is starting by doing something like this, right? It has been super empowering and amazing to hear from Phillipa's and Elisa's points of view. And I think that one first step would be like to open up our silo and to open up our little environment we work on, to hear from different perspectives and to keep adding to our work with all these perspectives. And also, as Elisa mentioned, thinking outside of the box and collaborating, doing together. And I love disruption. So figuring out disruptive ways of creating this new narrative that Phillipa told us about.
Yeah, Elisa, Phillipa, you want to add?
Elisa, do you want to go next?
Okay, yes, we unmute at the same time, Phillipa, thank you. Well, of course, I agree with Sara. I think it's about breaking silos, vertical ways of looking at things, or making, somebody in the chat, were talking about the fraction of rights. I really enjoy this expression. So I think one solution could be to break these fractional rights, because at the end of the day, we are talking about the same thing, looking at it from different angles, but try to rebuild together an holistic view of human rights and access to human rights from all perspectives is the way forward to break fractions.
Okay, so I've got a couple of things for me. What I do in order to learn more. I think as a researcher, I'm just a naturally curious person. So like a very tangible step is to follow a diverse set of activists. So immediately after this call, go and follow activists who work on malaria, or go and follow someone who works on, I don't know, disabilities if you're not working in that area. Go and follow activists who work on a completely different areas of work and read what they're sharing and learn about what they're sharing about. I think that that's probably one of the easiest ways to find linkages to other movements, and then find people whose ethics and values and principles resonate with yours. Anyway, I think the other thing is, I think that as a community, civil society needs to better understand economics and the economic downturn that's happening, and we have to work collectively around that as it's coming now. I was reading an article today about China and the debt to China of developing countries, and how we're all asking for debt relief from China, and the diplomacy around China accepting or not accepting to give that debt relief. And where are we as human rights activists pushing for that? We should all be in a mass group pushing for that debt relief from China, and putting fuel on that fire to make sure that we get that debt relief. And then we need to understand how that debt was created, and how it was created linked to the Belt and Road programs. And I think that's stuff that's interesting for me. I think also we need to get a little bit creative around our issues. Like in terms of road safety, how have things changed for us under lockdown? Like we're all homeschooling, we're all doing shopping online, where the gaming usage has gone up by 75%. Everyone's on Facebook, Instagram, Pinterest. I looked at Pinterest and put the terms road safety in, and I basically get like educational games for kids. That's all I get. Like adults who are 24 years old are locked in their apartments by themselves. Where's the online game that has an educational road safety aspect to it? Where is the shopping? When I go shopping for road safety, I do shopping, and the only thing I can buy is like goggles and safety hats. Where is the cool t-shirt that's funky, that's about road safety, that's got one of those like those more space for us hashtags? Like, why are we not being opportunistic in these moments? I think it's important for us to be opportunistic, not disrespectful, but opportunistic. And I think my last comment, sorry, is about oppressive regimes. I think it's super important that we understand how in some countries people are unable to move, that there is a quelling of data, of information, there's no transparency about what's happening. Human rights activists, as well as creatives and artists, who are those who usually fight against governments through poetry or performance, are the most under threat at this moment, because they're being arrested arbitrarily and stuff like that. And we need to put our social media weight behind that. We need to put some of our core cost funding behind that, and we need to get in there. That's it.
Thank you very much. I saw that there's a question specifically for you, Phillipa, from Donna, who's asking about, in connection also with road safety, the fact that, of course, it has been and it's continued killing millions of lives, a human catastrophe of immense human proportions, but largely ignored by the global community. And she asks why. She answers also herself, because they tend to be individual tragedies, leaving those affected alone to pick up the pieces. But yeah, there's not really a social vision around that. And so, Donna, I would like to ask you, Phillipa, how do we get the same focus on the plight of this huge cohort of traumatized people?
So I think one of the most amazing things for me was I learned around the psychology around accountability and what makes leaders take accountable decisions. And one of those things, one of the core factors, is the fact that they know that they're being watched. If they literally know that someone's watching them and monitoring them all the time and is on top of them, every decision they make, and whether they're programming it and implementing it and putting budget against it, they make better decisions. And that's why transparency is so important, and it's really difficult to do these things in oppressive regimes. The second thing about why, you know, decision makers make accountable decisions is the order in which the information they get. So that's why in a court, you know, in countries where you're innocent until proven guilty, usually the defense goes first, because the jury or the judge will believe the first set of information that's given to us. And I think what's happened with COVID-19 is that the first set of information that was given to us was very powerful, that this is something that's highly significant and that has changed the face of the planet. I think that with road safety, the issue has been around and gradually growing for so long that that first set of information that it's not a big deal has most people convinced. And it's very difficult to get people to change their minds once a decision has been made. One of the most important things I believe for the road safety movement to do is to get in with young people and to get them at their first decision making to make the decision that this is a super important issue. And that's not hard to do because youth are worse affected than other groups. I don't know that that answers Donna's question. You know, I think that I've almost been hit by a car twice since the lockdown because I'm too casual crossing the road and not expecting there to be cars. And, you know, I think that if you had, for example, there's more space for us hashtag. If there was a hashtag of, you know, during lockdown, I almost got hit by a car, that could be something that would bring that issue up as well. I don't know.
Yeah. Thank you. Yes, I think it's very good and relevant elements to bring to the attention. I saw that there are other questions. Let's try to answer at least to some of them, knowing the time is limited, but let's go to the next one. I see that Simon Patrick is asking how NGOs can work to promote human rights at a time like this, where restrictions to social distancing is firmly enforced and different restrictions are also applying. So how do we conciliate the need to still work and promote human rights and rules that are currently in place? I don't know if Elisa or Sara, you have any insight on this?
Yeah, so I would like to echo something that Phillipa already mentioned, which is using social media. And I think it's really powerful nowadays to use like a great hashtag and to tag those making decisions in order to raise awareness on this issue. But I have also found this international organization that's called Training for Change. And they do amazing online trainings in order to support human rights fights through an online platform as well. So they have been doing so in person, and now they are doing this online, which is challenging because we already know all the difficulties we may have to access the internet connection, but I think it's a really good source if anyone is interested in checking them out.
I would like to add to what Sara was saying, if it's possible, Valentina. I think one of the key entry point is to negotiate space and power there are rules, there are restrictions, but I see what's happening here. Civil society has negotiated space in order to continue providing services. I mean, even in a regime, and I would call it regime on purpose of lockdown, you do have permission as volunteer or as NGO worker or association or whatever to provide services for persons who are vulnerable, at least at this time, or chronically vulnerable. So I go back to my very first comment. I know it might look as a fixation, but the same space I was mentioning before is the space of being an active citizen. And I want space as an NGO worker, I want space as a citizen to be beside other citizens. So let's negotiate the rules for that space. I think that is the big challenge you have to bring to your own decision makers.
Yes, Phillipa?
I've been trying to find it on my WhatsApp group so I can post it here, but I can't find it. Actually, there's an organization called the International Drug Policy Consortium, and they've put together a how to organize during COVID lockdown manual, which is superbly interesting. And so I will put it up on my Facebook page, or I will ask Valentina and Lotte and Liz to
share
distribute.
some materials afterwards. Lotte and Liz from the Global Alliance can help us reach those who are participating to share additional thoughts or materials afterwards. So it's very useful to keep in mind. Yeah. And I think in relation also to, indeed, the space for civil society, I think there are two questions also appearing in the chat that are more connected to the role and the challenges of small NGOs that feel to be the last on the list, with difficulties in getting grants, for example, and also difficulties in being heard. But at the same time, they feel they're also the ones who are closer to the victims and to those in need. So I don't know. Yeah, the question, I think, it's also about how to be recognized, be mobilized, and receive support as small organizations. I don't know if any of you wants to pick this question.
Yeah, I will. I think some of the grant makers out there, some of the funding partners there are specifically focused on small NGOs and don't want the international NGOs anymore. And I think that it's a great way that funding is moving, to move much more towards community NGOs. I think community NGOs are much better value for money most of the time. And I think that where you can, you should also approach businesses. Something we haven't spoken about is the role of private sector in all of this as well, because they could also be a great source of funding for small community NGOs.
Yeah, I don't know, Sara or Elisa, if you want to add anything. Sara, you're also the founder of a quite small, from what I understand, organization. Maybe you have some tips or experience that you want to share about growing also in recognition and in your voice.
Yeah, we're super tiny, and I was actually excited hearing Philippa's recommendations because we have been struggling with it. But I also think that it relates to changing the narrative, and since the focus is now so much on getting less people with the COVID-19, being at home, take care of yourself, then all these other things we care about are like on a second plane, if you can say that way in English. So we are focusing so much on this health right, access to healthcare, and we are forgetting about these other rights. As Elisa mentioned previously, these are all rights. So we should be fighting for all of them. And I think maybe trying to change the narrative and showing these governments and private companies that it is important as well to put resources into this and not everything just to COVID-19, I think can be another way to do so.
Yes, and remember the big international NGOs need small ones, because basically big NGOs do grant management. Without small NGOs, do not implement anything. You do not carry out a need assessment. You do not deliver services. So it's again a matter of power, and negotiate with big NGOs, because you're the one doing the job.
And there's also a last question that I would like to pick from the chat, and it's specifically for Phillipa. A question from a psychology point of view. What are the elements or factors that trigger accountability? Is it the fact of not being scared of being watched? Is it about doing the right thing? What really motivates an actor, a duty bearer in particular, to be okay with being holding accountable?
As I said earlier, one of the things that affects good decision making is being monitored, being watched, and I think that that's an incredibly powerful tool. We do a lot of scorecards, and it's one way of kind of monitoring what's being done, and we do it at all different levels. So we look to see whether policy is in place, whether the programming follows, whether the budget follows, whether it's implemented, and then whether it has the correct impact. And so that's one thing. But looking at it more from a psychology perspective, Manpreet's question about what drives innate accountability, I don't know, a good parent? I have no idea. If I knew that, I probably, yeah, I'd be able to rule the planet. But I think that, you know, I don't think we can underestimate the importance of my boss, Ricky Gahositao. She always says, give people an A first. And I don't think that you can underestimate the power of people living up to your expectations. I think set the bar high for your duty bearers, watch them, work with them, hold them accountable, throw tomatoes at them if you have to. And I think that it's a lot of dialogue. It's a lot of dialogue. Yeah, I don't have the answer though, sorry.
That's great. I know that before the webinar, we also received some questions, all going a bit in the same direction, asking how the road safety community specifically can learn from these and can also move the road safety agenda forward in a context in which we know very well public attention and political attention is focused on the COVID-19. I think, and I would propose this to also Lotte and Lisa, we discussed it briefly before the webinar, to maybe dedicate some reflections or a piece in the next newsletter with reflections also coming from the Global Alliance of NGOs for Road Safety. Because the idea here today, it's really also to give the possibility to other sectors to come in and bring different perspectives, but it's definitely very relevant as well within the road safety community to think how in this moment, our agenda can be brought forward. So we don't forget about that question, and we'll continue replying and discussing about this also through the newsletter and other means. I think we're almost at the end of this webinar, so I will let Lotte come in, maybe with some closing words or key points that you would like to keep in mind from this very interesting discussion today.
Yes, I'm trying to get in. Maybe that's fine. That's fine. Thank you very much for, okay, here we are. I need to be allowed. Point taken, Valentina, on elaborating a little bit more on the road safety area there, and we'll definitely pick it up. I don't know if you are reading our newsletter, you can see everything is around COVID-19, and it's also around the Stockholm Declaration and the call for collaboration across sectors. And one of the aims with these sessions is really to try to bring in new people, new faces, new collaborators that we can work with. And your points around thinking out of the box is one of the reasons that we are having these. So our members and everyone here can get some new friendships, get some new collaborators in their work, because I think that's one of the ways that we will have to move out of this crisis as well, that we are much better at looking at the broader picture and working across our silos that you have talked about. We have a website, you know, where we are putting a lot of resources, a lot of the things that you have seen coming up here, but also some of the resources that you have sent. A lot of our members have sent us things. A lot of all the calls are there, and we'll definitely, if you could send Phillipa and Sara and Elisa could send whatever you have mentioned here. You mentioned the training for change, online trainings, Sara. Phillipa, you mentioned some activists that you're following. I don't think we need to put those resources there, but I think it's a call for all of us to remember that we should think outside the box, look what other people are doing. Maybe that's how I met Phillipa, actually. But also, and how to organize manual. I think that was you, Sara, who mentioned that as well. So there's a lot of resources definitely that we can learn from, and they will be put on our website. This is I can't remember now, 4th call, I think, of this series, and I am so, for me, it's such an interesting, the most interesting part is to get to know you and hear all the reflections you have, and get outside our road safety community. That's what COVID-19 have brought me, that we have been forced to do that. So thank you very much for joining us here. And this is one of the calls in the series, and the next call will be on emission and environment. We have one lined up which will be around gender, and we have one lined up around youth. So stay tuned, and please follow our communication so you don't miss these amazing webinars. And Phillipa, Sara and Elisa, thank you very much for joining us today. Valentina, thank you for guiding us through this session, and thank you to all of you around the world who have joined us. It's been amazing questions that you have had, as Ava says, inspiring. Thank you so much. Bye-bye.
Many thanks. Goodbye.
Bye.
Thank you.
Thank you, everybody.